I'm thrilled to be back again. This is, I think, going to be a bit different. I'm hoping we're going to have a lot of nice conversations. I'm going to describe this pre-event and ask my co-panelists to introduce themselves, but I will also reiterate that there are several other people who attended this interesting pre-meeting in the audience, and so I will, just a warning, I will ask you all to share some feedback as well through this process. You already met me, but I will just briefly introduce myself again and we'll go down the line. I am Khalid Peay. I am a social behavioral researcher with background as well in genetic counseling and bioethics, and I lead the Early Check Newborn Screening Program. So let's just sort of do down the line.
So again, I'm David Bick. I work at Genomics England working on the generation study.
Hello everyone, my name is Khalid Fakhro. It's Khalid, like David, it's not Khalid. I'm a geneticist by training. I work in the Middle East at a hospital called Sidra Medicine. We're a tertiary academic medical center for pediatric tertiary disease.
Hello everyone, Natasha Bonhomme with Expecting Health, which is the maternal and child health division of Genetic Alliance in the US. I'm probably most connected to this work here through my work in newborn screening education and family engagement, and lead Baby's First Test, a national resource center.
Good morning. I'm Aaron Goldenberg. I'm a bioethicist and social scientist at Case Western Reserve University in Cleveland, Ohio, and I direct our Center for Community Health and Genomic Equity at Case. Most of my research falls within the area of ethical, legal, social implications of genetics, genome sciences, and I've spent most of my career working on ethical issues in newborn screening and equity issues in newborn screening and pediatrics. And looking forward to talking to all of you.
Excellent. All right, I'm going to lay a little bit of groundwork about what this meeting was about and what it was like. It's actually quite different than many things that we do in the academic world. So I'll just give you a sense for it, but I will also ask the panelists, as you describe, as you answer my questions, please do provide a bit of feeling about what the engagement was like, what the actual meeting was like. So I think it's difficult to imagine, and we're gonna try to let you all have a glimpse of what this experience was like. So the pre-meeting that we had was supported by the Liberty Fund, which is a group that was founded in 1960 by Pierre Goodrich. And the intention of the Liberty Fund is to foster thought and encourage discussion on the enduring issues pertaining to liberty. And so, you know, that's pretty broad. And so some of the real focus is to encourage people from different backgrounds with different sort of disciplines to enrich their collective understanding and appreciation of the complex nature of a society of free and responsible individuals. So we're trying to take those very lofty kind of concepts and ideals and put them in the context of sequencing for newborns. And I think to make these sort of lofty ideals even more interesting, we had a very diverse set of individuals who attended this meeting. And they included scholars in philosophy, law, ethics, economics, medicine, advocacy, and genomics. So we truly had a transdisciplinary group of individuals and a wide breadth of expertise in the room. Prior to the meeting, we were asked to come prepared, having read a really diverse set of pre-readings in philosophy, ethics, and law. And those texts were what we used to actually generate our discussion. And we had a moderated discussion, which was fascinating and really moderated with questions rooted in the text that are not things that we necessarily think of day to day, those of us who work in genomics and advocacy around genomics and the ethics of genomics. So it was absolutely fascinating process. So with that, I'm gonna now ask my co-panelists to respond to a couple of questions about their experience and what they took out of this very interesting experience that we had. My first question for the group is if you could talk about what you found to be the most important takeaway of these 2 days together, particularly for implications of sequencing for newborns. So what was the most important takeaway for you? And I'm going to start with David here on this question, and the next one I'm going to start with Aaron. So.
Right. So I had actually done this once before at the first conference in Boston, and I did find the experience very interesting. I guess, again, just to go back to Holly's point, their central focus was to bring groups together, and they do this with like 40 or 50 groups around the world, and they do it on every kind of topic you can imagine. But they're really focused, in my mind, on what are an individual's freedoms and responsibilities, and what are society's sort of rights. And they sort of, the questions and the readings and the discussions sort of makes you think about your sort of underlying assumptions, right? So everybody in this audience, just sort of think about, like, what are your ethical principles? Like, when you get up in the morning and think about coming to work on, say, newborn genomics, you come armed with a whole raft of assumptions. And we never, I rarely, question those very deep assumptions, because I lived in the US, I now live in the UK. I live in a society where, and I grew up in a society where there were certain kinds of assumptions about behavior and what were my rights as an individual, and what is the government like doing, and whether I like it or not. And so, like, we each have, there's this constant tension that goes on between what it is that you want to do and what it is that society will really allow you to do. And so this conference really made you think very hard about, like, oh, I have this assumption. And then if you start actually looking at newborn screening through the eyes of those assumptions, then you start to really, it sort of helps you crystallize, like, what does perhaps make sense to do, and where is there uncertainty? And that one of the themes I hope we get back to is risk and uncertainty. So that's my 2 cents.
Thank you.
Yeah, so this was actually my first time doing this, and I think we can talk about process a little bit later, but I think for takeaways for newborn sequencing and genomic newborn screening, I think one of the main takeaways was it was a room full of potential experts on this topic, but there was very little in terms of overall agreement. I think it was the putting us under the microscope of philosophy, and really trying to think more abstractly about questions of why, about questions of consent, informed or otherwise, about autonomy and privacy, versus public good and public health. And the fact that we come from different backgrounds, we had people from traditional Western settings, there was people from the Middle Eastern settings, Eastern settings. So you get, every society has a different lens, and there's a different interplay between government and what became referred to as socialized healthcare, where you have someone covering your costs versus privatized healthcare and reimbursement models. So the takeaway, to keep it a long story short, is if you're looking for consensus to start, you're never going to get started. And I think the point of this conference is that everyone is just saying how they're getting started. Let's just get the wheel spinning, and then we'll keep each other updated and looped in on our progress and our challenges, shared challenges, individual challenges. And we as a community we rise, and then eventually when this becomes looking at it a decade or two down the road, when this becomes routine, we'll always think back to these fun discussions we used to have.
It was like you both have already said so much. For me, what I kept coming back to during the 2 days was, what do we really mean by benefit? And how are we going to keep ourselves accountable to whatever ideal we are aiming to, whether that is everyone benefits equally, everyone benefits differently. And what does that mean when we think about benefit of the baby or individual compared to the family, compared to society? And again, because we all came from so many different backgrounds and different cultures, and we walked into the room, you know, of course, with our own assumptions. I was like, oh, well, I've always thought of this. To really kind of challenge that and to say, well, there isn't alignment there. And not that there necessarily needs to be alignment, or we don't all need to be doing the same thing or have the same approach, but how critical it is to at least call it out and to say, oh, that is a different approach. Of course, your strategy is different and potentially your outcomes will be different. But I think to have the opportunity to, I think so often when we come together and we're talking about genetics and genomics and newborns, we look at everything through that lens. And this really pushed us to look at things through the lens of, I wouldn't just say philosophy or ethics, but reality and what people really are going through and what people's real values are. And I think that's very beneficial, and it would be great to integrate that into a lot more of the discussions we have on this topic.
Yeah, I totally agree, and my comments are gonna, I think, mirror some of those. I think one of the things that I came away from the meeting thinking about is how insufficient our distinctions between research and practice really are. And what I mean by that is not only are there blurred lines between research and practice, but our decisions about what our programs are they public health? Are they medicine? Are they direct to consumer? Are they meant to be a public good, or are they a choice that families can make? How maybe unprepared we are for answering definitively what our programs are and what they always will be, but the hope that working together can get to figuring out what that looks like, given how much those distinctions will matter for everything we do, the way we design our consent processes, the way we think about return of results, the way we think about equity and who has access to our programs. All of that will really depend on the ways in which we define what we're doing. And we may be doing lots of different things. If we're thinking about genomic sequencing as a public health good and should be, part of a public health program, that's a very different approach to all of these questions than if we're thinking about this as a medical choice that someone may make in their doctor's office or through a company or through, some combination of all of those. And again, that's not to say one is better than the other, but just to say that the important decisions that we all have to make depend on how we think about that idea of a public good and that idea of what genomics is meant to be for families. And how much of that comes down to the values. Our values as clinicians and researchers, the values of our patients, the value of the information, all of which are questions that we're answering together. This idea of the team, that we're all on this team, I do have a lot of hope that together these kinds of conversations can lead us down that road to answering those questions that are just so crucial.
Excellent, thank you. So the next question I'm going to ask the group is around what surprised you about the process or the outcomes. And I'm going to start personally by reiterating something that David mentioned. Was I was quite surprised by how rooted all my thinking is in a very consequentialist view of the world. And it really was fascinating and interesting to have people, we talk about nudging a bit, but have people nudge us out of these sort of rooted ways of thinking about technology and consequences of technology and the impact on the public. So I was thrilled with that sort of nudge out, and actually got some advice about other sort of philosophers and thinkers we should be looking at as resources as we try to anticipate some of the challenges that arise, and as we even put a lens on what the benefits and the risks are of the kind of work that we're doing. And with that, I am going to go back to you, Aaron. Sorry to put you back on the hot seat, but it's nice to mix it up a little bit. Surprise. What surprised you?
So I don't know if surprise is the right word, because I kind of anticipate this in a lot of all of our work, but maybe some of the things that surprised me is we tend to think about ethics in our very traditional ways. It's consent, It's the privacy, privacy measures we put into our programs, the regulatory structures, whether it's through an IRB or whatever it is. And I think I was just surprised or excited by the fact that everything we talked about have these really interesting ethical dimensions. Whether it is a conversation about consent or whether it's a conversation about deciding our algorithms for what variants we're going to be giving out or not that have ethical dimensions that sometimes we don't talk about as much. And I loved that we spent time really thinking about the biases that we have that go into the decisions that we make about what conditions we're looking for, what variants we're looking for, and that we can have 6, 7, 10 programs all using similar processes and come out with very different lists of conditions means that there are inherent values, biases, and different kinds of things. That doesn't, and again, that's not meant to be a negative, that just go into the ways in which we make decisions and how important it is to have these kinds of conversations, because all of the work that we do isn't value-free. It isn't totally neutral. It has ethics and social issues and equity issues embedded within it. And I was surprised and excited that that was like part of everything we talked about at the meeting.
Yeah, I don't know if surprised is the exact word for this, but it was very interesting to me how often the idea of protecting current newborn screening came up in the discussions, and how, even though newborn screening looks different in the different countries that were represented, but really this idea of newborn screening, public health, that is very important, and we have to keep that the way it is. I'm like, asterisks. We never defined exactly what that meant, what it is, right? In terms of both the really great work that has happened and also the challenges we still seem to face. And I thought that was interesting because then when we would talk about sequencing and the different sequencing programs, questions about, are we going to be creating issues around equity? And to me, I thought, well, it's not as though those would be new issues. They are there, even in our really great and successful newborn screening programs. There are differences, there are challenges, there are ways to improve. And so I just thought that was really interesting from all the different perspectives of whatever traditional or standard newborn screening meant to whoever was speaking at that time. It was seen as extremely important. And what we are doing could either be an extension, as was said earlier in the opening, potentially an extension or separate. And there was no guise of trying to align on that. But I think it was important, because we were looking at it from a philosophical lens, to note, oh, well, I guess we are speaking a little bit differently. And as we went from day 1 to day 2, I think people gave a bit of that, not caveat, but their own context. More so as we went throughout the day, because we saw that there was the difference, even though there was kind of that unifying theme of newborn screening is good, we need to be able to protect it, and it's so important the way it currently is.
I'll talk more about process, because I think that's the 800-pound gorilla, if you will. When I was invited to the Liberty thing, I thought, oh, cool, I'm going to talk with some experts about stuff around newborns, and I'm going to learn, and they're going to learn from me, and it's going to be a fun two-way dialogue, and yeah, sure, sign me up. 2 weeks later, about 300 pages come, there's this big binder thing that came through FedEx, 300 pages of text in economics, law, philosophy, and I'm not knocking those disciplines, they're just really, really thick to read. And everything is in 8-point font, and you have to fight insomnia to try to keep all that in your brain. And then you sit in a room, and for an hour and a half you discuss 3 readings at a time. It's very well moderated. It's very well structured. I was surprised that I came away being surprised that this Liberty Fund thing exists that I just never knew about. And apparently, as David alluded to earlier, this takes place on many different topics, all around the world. And just the fact that there is a protected funding and a society pushing this around the world to really spread just ideas for the sake of spreading ideas and bringing people together from different disciplines, that's the thing that I think struck me most. You know, we come from a time now where we're inundated with, you know, breadth and shallowness. There's a lot of stuff on social media. We just read headlines, you know, some of us read abstracts only or flip through figures and papers. We rarely take the time to dive into an idea and deconstruct it. And some of these readings really do this at excruciatingly painful detail, but to the point where, you know, it's like the same guy is fighting with himself about an idea. And thinking about that process as a scientist today, trying to apply these things in my own local context, thinking about this as it applies to newborn screening, but, you know, more generally to public health and public good, that I think was, you know, for me the most surprising thing about just the process of what we had to go through. And, you know, to this day I feel like I'm in, you know, post-traumatic stress because there's the sheer amount of stuff that I've had to consume and process.
Yeah, so I think I'm sort of where Khalid is, which is I felt like when I went into the meetings, even though I had done this once before, when I went into the meetings, I'm so sort of deeply involved in sort of like thinking about newborn screening at every level, and that I had these ideas that have come through a lot of discussion with lots of people, but I thought I had some like fixed, useful ideas, but I don't. And so it got me out of that frame that you have these really fixed, good ideas. Now, at the end of the day, each of the programs that you're going to hear today are going to make some decisions, because you have to make some decisions, right? But that each of the programs is going to make decisions that are relevant to that country, that location. And that's correct. And you know, I've said this before, and I'll say it again. I mean, that really is the correct way to proceed with research into newborn screening. But I think that's still going to be true even, you know, someday if the data supports it, this will be done in countries all over the world. But I think when it finally gets done, I think it's going to be different in different countries. And so that was one of the things that surprised me, a little bit annoyed me, is how narrow-minded I am. So it really got me out of that, like, oh, this is kind of the right answer, but more like, here is an answer, and we are going to try this, and we really do need to be really thinking about, like, what are the social values that the moms and dads have, and are we really going to, and that we really must listen to those values and those things that are important. And no matter what we think as the physicians and the scientists and stuff, we really have to value those things. So it got me out of my like local David Bick thing and into a better place.
Thank you. So we did not have the luxury of having this whole group engage in this really dynamic and fascinating process. But these questions around ethics and morality and doing what's right in right context are things that surely you all think about too. So with that, I would like to open it up and ask if there are questions or comments from you all around these kind of issues more of philosophy and ethics around this type of work. So it's hard to look up there. There are people I see with microphones. Do folks have questions or comments that they would like to make? And again, I know you weren't some of you weren't part of this process. A couple of you in this group were. So if there are people who are actually part of the meeting would like to say some things, we'd love to hear from you as well.
Hi, I'm Amanda Peay from Genomics England. I wasn't at the meeting, but it's fascinating to hear about it. So I guess what I often wonder about is the kinds of assumptions that we make around consent. I know that's a common area that comes up a lot, but in particular, how granular we need to be when it comes to some of these big and complex areas like genome sequencing with many conditions, long-term data storage, potential future research implications that we aren't able to sort of well define up front. And I think we all have very different views about what informed consent means, but I wonder if also thinking about it from an individual responsibility lens, how much we should be defining that versus each individual. But on that basis, how do we help facilitate consent for each individual, especially at scale? So I'd love to hear thoughts from the panel about that and if that came up.
Yeah, fantastic question, and definitely lots of conversation around that. Who would like to start? Looks like
Me? Okay, I'll start. I was smiling because even though you weren't at the meeting, it sounded like you were, because those were the exact questions that came up, including one person on this panel's favorite word, scale, which is very important.
that's me.
That's Holly. And then this is something that many of us talk a lot about, and what do we mean by consent? I always say we try to have consent be at least 5 different things: an educational tool, a legal tool, a warning, a benefits list, and many other things. And no one thing can be everything to everyone. That being said, there are models out there, and this has been tested out, and we're still learning in terms of how granular do you go, how do you give the opportunity to an individual to say, actually, I just want the high level and I'm good with that and I will be fine with that, versus I want to be able to see everything. It doesn't matter if you think I understand everything. I want to be able to see it, and everything in between. The discussion also went to consent in the meeting in speaking about recent lawsuits in the US, where there is an active, in Michigan, what many would consider a very active consent model around blood spot storage, and there was still a legal case, and Erin can give more of the details of that if you would like. But it really just showed that even if we do everything that we think, especially from a research perspective and a research lens of doing everything right, that doesn't mean someone can't come along and say, no, that still wasn't right or wasn't right enough, especially when we're looking at it at these different lenses, right? This is a great educational model, but it may have not been a great legal approach. Again, back to this idea of what happens when we try to have one thing or one process be everything. So I know that's not an answer, but I'll let my panelists chime in with that. I did the framing as the first one, right?
I'll just add a couple things. One is the discussion that we had around, I'm trying to think of the right words, but harmonization versus localization in our consent processes, and the importance of thinking about shared things that we may want to see in all of our programs. We hope that no matter which program you're looking at, there are certain kinds of things that every consent form might have, and being able to share models and share language and work together is really, really important. But localization's also really, really important. And whether that's cultural context, whether that's religious context, whether that's geographic context, whether there's differences between countries or states, and or even just regions in a city, that sometimes we need to be thinking really dynamically about what is needed in consent in both those terms, in terms of harmonization and localization. I'm from Michigan, as Natasha is saying, and thinking about trust in state government in the state is very different in different parts of the state. So if you're in Detroit, the worries about state government looks very different than if you grew up in Flint, where there's been a water crisis for over 20 years, and there's a lot of distrust of the government. So you need to be thinking about localization in the sense of what you're talking to people and what kind of granularity do you need, exactly to your point, what kind of granularity do you need to make sure that you're covering those local needs. And the other thing that referred to David's point earlier, I think how difficult consent is when we're dealing with so much uncertainty. And as we think about how we address uncertainty and risk, and how do we address how patients value uncertain information and how patients address uncertain information. I think in the ethics world, we tend to think of uncertainty as somehow just automatically bad, like we don't want to give, but we're finding in many of our studies the resiliency of families, the ways in which families are integrating information. But it's a challenge for consent. That's a really hard issue for consent and education, is how do you get across, I think, David, you said yesterday, the unknown unknowns that are part of all of our work and what that uncertainty looks like. So,
I think this panel will give you more questions than answers. And talking about consent, we also talked about in different parts of the world, the consent structure is different. So, we tend to think of individual autonomy and the ability to give consent, whereas in different parts of the world, might be the family gives the consent, sometimes the tribe gives the consent. So, and the consent binds the individual in those cases. I think the other thing that complicates this matter here is when we talk about newborns is it's not the newborn giving the consent, even though you're studying the newborn. It's really the parent giving the consent for the newborn. And then we had a lot of discussion on the semantics of what informed is. It's kind of easier when you're talking about a binary or a small set of diseases that I can explain these to the parent. When you talk about genomic diseases, I mean, even as a trained, qualified, PhD Mendelian geneticist, I still don't know 95% of all of the diseases that exist. So how are you going to communicate that information to a parent who has, really zero understanding of genetics and health? So how do you start that conversation? It's going to be a challenge, and I think that challenge is not only healthcare related. It's going to be educational. You're going to have to go in, through media. You're going to have to go in through many different pathways to bring the public to the level of understanding of what you're trying to do for them. Because even though you, in your heart of heart, believes, you believe that what you're doing is for their good, they may not agree with you.
Yeah, so Amanda, you really nailed this, because this whole issue of consent is so important. So I'm going to do something slightly rude, and you'll all have to forgive me. How many people have children? Yep, raise your hands. Okay, now of those people who have children, how many remember the newborn screening being done on your child? Ooh, a fair number, more than I expected. How many of those people were asked if they wanted to have it done? A much smaller number. So here becomes the consent problem that is going to be raised, which is, in our programs, we're going to be doing consent, but in newborn screening around the world, for the most part, moms and dads don't know that it was done. And if they do know it was done, nobody asked them. And so here's where Natasha really helped me get out of my crazy David thinking. She said, David, you can do it unconsented, right? The way newborn screening is done today for the most part, right? I mean, because we have a fairly educated group here. Or you can do it consented going forward. But countries around the world are going to have to make this decision. And so that was one of the lessons for me that came out of this, which is directly about what Amanda's talking about, is current newborn screening going to become consented more than it is, or is whole genome sequencing or genomic screening, is that going to become unconsented, or it'll be somewhere in between? And I think that that's an incredibly important, I have no answers, but I think that's an incredibly important question. We spent a lot of time on that.
Fantastic, yes, thank you. That was a perfect question. Are there other? Okay, well, there's one up there and there's one here too. So I believe you're up there, but I can't actually see you, so please go ahead.
Newborn screening in the 1960s, it's still evolving in terms of the system of delivery. Has there been thoughts about getting a group of state newborn screening leaders to meet together? Because I'm in the state of Maine and New England, and obviously there is no group that's addressing sequencing, and everybody's seeing it advance, but those that deliver it don't know what's going on.
Yeah, that's an excellent comment about bringing different groups into the fold in these very complicated discussions. And so I definitely take the point that we need to be doing more robust, deep work with our state newborn screening programs. And so I will ask the panel to respond to that, but I also think your question brings up one of the critical things that was part of this discussion, which you've heard a bit about already, which is are we talking about something that will happen in the newborn screening program? Are we talking about something that will happen in the clinical realm? Are we talking about something that will really forever be a research endeavor? And so I think the ultimate home of this sort of work that we're doing is part of what we need to answer with our collective research. I'm going to ask if anyone would like to respond to these questions. Yeah.
Yeah, I want to, with that question, it's funny, I wanted to look at you, but then I felt like I'm looking into the heavens, and it's like, okay. But wanted to acknowledge people who are in the audience who either work in a state or work very closely with states. We have representatives from the Association of Public Health Laboratories here. We also have representatives from CDC who will be presenting, and also some other state partners. So I think that, yes, it should go both ways, right? It's both groups inviting each other in and realizing, oh wait, actually we're kind of one group. You know, we're all looking for answers to a similar question of what does the future look like? And I would say not for newborn screening, not for sequencing, but what does the future look like for using genomics and genetics to help the kids of our countries, of our states? To me, that's a better question because it gives room for both in a number of different approaches. But I would say, yes, those conversations are happening, and there are people here who are leading the way for that.
I totally agree. I would also just add one thing, which is that the question itself made me think about something else that, I don't know, I was kind of constantly thinking around, while we were discussing over the last few days, is this question that a professor of mine always drilled into our heads anytime we talked about anything, really anything in a bioethics, a world of bioethics and medicine and public health, which is to consistently ask ourselves not just who's at the table, but who's not at the table, and who's not part of the discussion, and who needs to be part of the discussion. And one of the things that I'm excited about with ICoNS is that there's a lot of openness to inviting different stakeholders, different groups, different parents, advocacy organizations. But I think we should always be asking ourselves who's not at the table, whose voices are not being heard, because that's how these programs evolve. That's how we answer some of these difficult questions, is by making sure that everyone has a voice. And sometimes that means going out of our comfort zones. It means bringing in voices that we haven't heard from before, and really just kind of thinking, how do we expand that table?
So just one thing that came up during the conference was something that there was a whole discussion on medical paternalism, right? And there was a discussion about seatbelt laws and that there are government mandates, and that the society thought that that was a good idea. We all have to wear seatbelts. But then in New York City, they had a tax on sugary drinks, and do you have the right to become obese if you feel like it, right? So there was that. But in the newborn setting, it turns out that we're being paternalistic. I, David Bick, have been paternalistic. I've been helping to decide which conditions are on the newborn screening panel. But wait a minute, yes, David, you went out and you asked a whole bunch of experts around England, but to what degree have we really included everybody in this discussion? And now, hopefully, by our sharing the list, we're hopefully engendering that discussion, but I recognize myself as being paternalistic. And so I guess in that sense, I would ask the individual from the gallery, yes, please join our call for the ICoNS monthly call, because we have to have all the people at the table who are important in this process. And so that would be my plea.
Excellent. Yeah, anyone's welcome. I think Lil has a question. Oh, right.
Thanks, Holly. My name's Lil Downey. I'm from Melbourne, Australia, and I was very lucky to attend the Liberty meeting. And I was just hoping to nudge the group to talk a little bit about the discussion around equity, because we have these great newborn screening programs that have very good access to all our newborns, but there's not always equity in the outcomes despite that. And there was some really interesting discussion about whether adding genomics in a newborn screening space would increase equitable health outcomes or actually widen the gap in some communities.
Yeah, thank you. We had a lot of great discussion about that. Who would like to start? And we are running a bit low on time. I would like to get at least one more question, so let's keep our responses relative. No pressure, no pressure.
We did, Lily. We did have that discussion. And again, I think that goes back to some of the themes that were in the opening of today in terms of what do we mean by that question, right? I think depending on the context you're coming from, you may assume that that is maybe racial or maybe geographic. And again, we have to think about what does that mean? What are we layering upon? And actually, I think the comments you made at the meeting really helped me think about that in terms of what is owed and what should we prevent. If you do look at it as though adding sequencing in a program would just be adding on another layer of inequity, what is the responsibility there? And I don't think, at least in the States, we don't necessarily talk about it that way, but I thought that was very important and helpful to think about. But again, back to the idea of that word means a lot of different things in different contexts and to different communities and in different countries and thus in different programs. But that doesn't mean we have to just glide over it. It means, okay, well, what do you actually mean by that? And not that there's a right or wrong answer, but you have to at least address it. That's what I would say came out of our meeting.
Yeah, if I would just add a really small point to that, it's not just about equity of access to the platforms for sequencing, but it's also equity of access to information, to experts for follow-up, and the entire healthcare system. It's really thinking of equity from many, many, many different angles, not simply the ability to access the platform.
Yeah, that's a really important point, and I think both of your points raise this kind of larger question, which I think you're saying, which is, what really is our responsibility to address equity? What is our responsibility to address equity in our programs, in genomics generally? We all live in healthcare systems or with healthcare systems that have their own equity issues. Those equity issues affect our ability to make sure there's access to technology, make sure there's access to treatments. What is our responsibility as genomics experts, as those running genomics programs to address those equity questions? And I think that really depends on the former question that we talked about before, which is, do we think about genomics as a public good? And how do we think about genomics as a public good? And are we talking about a public health program? Are we talking about a medical program? Equity is part of all of those things. We need to be thinking about equity and inequalities in all of those decisions. But how we do that and what we think our responsibilities are as a program really may vary and is an important question for all of us to be striving for equity in our work. But exactly what, Natasha, you're saying, what does that actually mean?
Fantastic. All right, we have a lot of questions, but we have 1 minute left. And I'm imagining Nick is sitting there saying, please don't take another question because one more. Okay, so we can do one more. All right, so I'm not going to pick. I'm going to allow whoever. I don't know if people with the microphones have been. Is someone already have one? Yeah. Oh, okay. All right, well, the person with the mic wins.
Tom Westover. I'm an obstetrician, maternal fetal medicine physician in New Jersey, U.S., who's involved with prenatal diagnosis and newborn screening policy development for my state of New Jersey. And my question is related to, a little bit related to equity, but to panel content. So we know that most of the data on variant classification comes from a limited number of ethnicities, both from abnormal, quote-unquote, abnormal variants and, quote-unquote, normal variants in the general population. And I'm wondering, because it seems like most of the programs are coming up with pre-specified content for genes, which means pre-specified content for variants. And I'm wondering how the programs are balancing the fact that we don't know the percentage of quote-unquote unknown variants in other ethnicities versus kind of a limited number of ethnicities that we know about. I'm wondering how the programs are handling that unknown content, and are we basically just driving the same prejudices and biases we already have in healthcare into this world as well?
Okay. Who wants to do a rapid?
You get to do
no,
it. Because you're running out of these.
Moderator.
No, you have to speak.
Oh, come on, you're making
Well, there's
me
your
have this one.
answer.
No one wants to answer you. I mean, we talked about a variety of different sources that could lead to different inequities, and that is an important challenge. And I think our programs are dealing with, I don't want to speak, so you guys have to tell me if this is correct, but I think we're thinking about ways that we can help offset some of those challenges, but they 100% exist, and it is, we have to deal with the state of science and the knowledge that we have. And so I think some of the ways that we're trying to offset some of those challenges are being, again, very thoughtful about making sure that we are looking at gene condition pairs that have impact across different populations by many of us not reporting variants of uncertain significance, which has implications on both sides, sort of positive about how we can interpret, but perhaps negative about children who we will miss. And that raises, I think, lots of important questions about the responsibilities of a sequencing program that is intended to be a screening program rather than a diagnostic program. So any other final comments?
Well, doesn't it go to the core issue of whether this is public health screening or actual research?
Yeah,
So this
absolutely.
is screening for specific genes, variants, and diseases, or are we trying to do disease investigation and learn some of the other intricacies and nuances of things that lead to adverse outcomes?
Excellent
And
question.
then the only thing that I would add to that is in terms of engagement, because I think it's very easy to have that lead to a strategy of engagement that's, oh, your community hasn't been included, you should really sign up so your community is included, and not saying, the silent part, which is your community's been excluded, but now we need you in so that we seem inclusive. And so I think that came up in our discussion, and I think there's the education and communication side as well as the scientific.